So, coming to paranasal air sinuses. Paranasal air sinuses are the air-filled spaces present around the bones, which are present in the bones around the nasal cavity. So, the paranasal air sinuses are the air-filled spaces which are present in the bones surrounding the nasal cavity. The paranasal air sinuses, they are 4 in number. First one is frontal air sinus, which is present in the frontal bone. Maxillary air sinus, which is the largest air sinus present in the maxillary bone. Frontal air sinus, and maxillary air sinus, maxillary sinus, and sphenoidal air sinus, sphenoidal air sinus, and ethmoidal air sinuses. These ethmoidal air sinuses, they are 3 in number. So, anterior, middle, and posterior. Okay, these are the paranasal air sinuses. They are present at the bones around the nasal cavity. Okay, so all these paranasal air sinuses, they act as conditioning chambers. They humidify the inspired air. They humidify the inspired air, and also they act as conditioning chambers of the inspired air, and they cause resonance to the voice. So these paranasal air sinuses, they add resonance to the voice. Because of this, they add resonance to this voice. They make the skull lighter also. These paranasal air sinuses, they makes the skull lighter. They add resonance to the voice, and they humidify and condition the inspired air. They warm up and humidify the inspired air. So the paranasal air sinuses, they are situated in the bones present around the nasal cavity. There are 4 paranasal air sinuses. There are 4 pairs of paranasal air sinuses. They are frontal air sinus, maxillary air sinus present in the frontal air sinus present in the frontal bone, maxillary air sinus present in the maxillary bone, and the sphenoidal air sinus present in the body of the sphenoid, and ethmoidal air sinuses present in the labyrinth of the ethmoid. These paranasal air sinuses, they open into the lateral wall of the nose between the superior, middle, and inferior meatus. These paranasal air sinuses, they make the skull lighter, and they warm up and humidify the inspired air. Okay, so coming to the frontal sinus. These frontal sinus situated beneath the frontal bone. We know that this is the frontal bone, right? This is the frontal bone. This frontal air sinus situated beneath the frontal bone, and it is present at the superciliary arches. Present beneath the superciliary arches. The superciliary arches corresponds to our eyebrows. So they are present beneath the superciliary arches. It extends upwards. It extends upwards at the medial end of the eyebrow. It extends upwards at the medial end of the eyebrow, and also backwards into the orbital plate of the frontal bone. It extends backwards into the orbital plate of the frontal bone. So the frontal air sinuses, they are present behind the frontal bone. Deep to the superciliary arches, which corresponds to the eyebrow. Superciliary arches, they are present here, which are corresponds to the eyebrows. They present here, which are corresponds to the eyebrows. Deep to the medial end of the eyebrow, they extend upwards and backwards into the orbital plate of frontal bone. So the average width and height and anteroposterior diameter of the frontal air sinus is about 2.5 centimeters. Average height, width, and anteroposterior diameter of the frontal air sinus is about 2.5 centimeters. And this frontal air sinus, it opens into the anterior part of the hiatus semilunaris in the middle meatus of the nose. So this is the opening of the frontal air sinus. Opening of frontal air sinus, which opens into the middle meatus of nose at the anterior end of hiatus semilunaris through infundibulum or through frontonasal duct. So this is the superior concha, middle concha, and inferior concha. Beneath the middle concha, we have passages. We call it as middle meatus of the nose. And beneath the middle meatus of the nose, in the middle meatus of the nose, we have a bulging called bulla ethmoidalis, and beneath that we have a semicircular groove called hiatus semilunaris. So the frontal air sinus, it opens into the anterior part of the hiatus semilunaris through frontonasal duct or through infundibulum. So this aid sinus, it is supplied by the anterior supraorbital nerve, and it is also supplied by the supraorbital artery. The veins drain into supraorbital vein and superior ophthalmic veins, and the lymphatics drain into the submandibular group of lymph nodes. So the frontal aid sinus, it is supplied by the supraorbital nerve, and the artery is also of the name supraorbital artery. The vein is also same name, supraorbital vein or into superior ophthalmic vein. The lymphatics drain into submandibular group of lymph nodes. Okay, so that's about the frontal aid sinus. So frontal aid sinus is present beneath the frontal bone deep to the superciliary arches. Okay, and coming to the maxillary aid sinus, and one more important point about this frontal aid sinus. The frontal aid sinus, usually all the paranasal aid sinus, they are rudimentary or absent at birth. All the paranasal aid sinuses, they are rudimentary and absent at birth, and they highly developed at the age of 6 to 7 years. That means at the time of permanent eruption of permanent teeth, they highly developed, and after puberty also they highly developed. And the growth of the sinuses, the growth of all these paranasal aid sinuses is due to the enlargement of bone, and also in adult life, in old age, it is due to the resorption of the cancellous bone. So all the paranasal aid sinuses, they are rudimentary or absent at birth, and they highly develop during 6 to 7 years of age, that is at the eruption of permanent teeth and also after puberty. And these sometimes the frontal nasal aid sinuses, they may be absent on one or both sides. They highly develop during 6 to 7 years of age and then after puberty. So that's about the frontal nasal aid sinus. And coming to the maxillary sinus, it is present beneath the maxillary bone. So this bone we call it as maxilla, right? So it is present beneath the maxillary bone, and here the maxillary aid sinus is the largest largest paranasal aid sinuses of the body. Okay, so the maxillary aid sinus, it is in the shape of pyramid. So the apex is here, directed here, which is formed by the zygomatic process of maxilla. So we know that this is the zygomatic arch. We can palpate the zygomatic arch here, and this is the zygomatic arch, and the apex, it is directed towards the zygomatic process of maxilla. So this is the part of the maxilla which is attached to the zygomatic bone. We call it a zygomatic process of maxilla. And the base is directed towards the lateral wall of the nose. So the apex is directed towards the zygomatic process of maxilla, and the base it is directed towards the lateral wall of the nose, and thus maxillary aid sinus, it opens into the posterior part of the hiatus semilunar. So this is the opening of the maxillary aid sinus. And the maxillary aid sinus is the first sinus to develop. This is the maxillary aid sinus. It is the first sinus to develop. In an isolated maxilla, the opening of the hiatus or the opening of the maxillary aid sinus is more, but in an intact cell, this is the opening of the maxillary aid sinus. This is the opening of the maxillary aid sinus. Here it is overlapped by the hiatus. It decreases to 3 to 4 centimeters in size. Usually in an isolated maxilla, the opening of the maxillary aid sinus is large. But in an intact skull, the opening, it is decreased to 3 to 4 centimeters because of the overlapping bones. Because in that cell we have more skulls, they overlap the maxillary sinus. The opening of the maxillary sinus, it is overlapped by more number of bones. What are the bones that are opening the hiatus of the maxillary sinus is, this one is called nasal bone. Lacrimal bone. This bone we call it as lacrimal bone. The descending part of lacrimal bone and the uncinate process of the ethmoid bone. This is the uncinate process of the ethmoid. Uncinate process of the ethmoid bone. Okay, and inferior concha and the inferior concha below, and the perpendicular plate of palatine bone. These bones, they decrease the size of the hiatus of the opening of the maxillary sinus. That is, they decrease the size of the opening of the maxillary sinus. What are the bones that decrease the size means? One is descending part of lacrimal bone, and also the uncinate process of the ethmoid bone, and also inferior concha, which is an independent bone, and behind we have perpendicular plate of palatine bone. This is the perpendicular plate of palatine bone. Perpendicular plate of palatine bone. Okay, so these bones, they decrease the opening of the maxillary aid sinus. Okay, and the average height of the maxillary air sinus, it is about 3.5 centimeters, and anteroposterior diameter is also 3.5 centimeters, but the width of the width is about maxillary air sinus is about 2.5 centimeters. It is the first sinus to develop. Okay, and one more thing is this maxillary air sinus, it is frequently infected during sinusitis. This is the most important frequently infected sinus. We know that the infection of the sinus, we call it as sinusitis. Maxillary air sinus, it is the mostly infected paranasal air sinus. Okay, and then so arterial supply of the maxillary air sinus. Arterial supply of the maxillary air sinus by the facial artery, infraorbital artery and greater palatine arteries. And coming to the venous drainage into pterygoid plexus of veins, and also into pterygoid plexus of veins, and also into the facial vein. And coming to the lymphatic drainage of the maxillary air sinus, it is drained into submandibular group of lymph nodes, and the arterial supply is by the posterior superior alveolar nerves and the anterior and middle superior alveolar nerves, which are nothing but the branches from the maxillary nerve. So that's about the maxillary air sinus. So the maxillary air sinus is the largest air sinus of all the four paranasal air sinuses, and is the first sinus to develop, and it highly develops during the 6 to 7 years of age. And this maxillary sinus, it is pyramidal in shape, apex directed towards the zygomatic process of maxilla, base directed towards the lateral wall of the nose, and the floor, it is formed by the floor of the roof, it is formed by the floor of the orbit. We know that this is the roof of the maxillary air sinus, which is formed by the floor of the orbit, and the floor, it is formed by the alveolar process of maxilla. And the alveolar process of maxilla, we can see, and the floor, we can see numerous conical projections are present in the floor of the maxillary air sinus because of the roots of the premolar and molar tooth. Roots of the premolar, they form conical projections. So the floor, it is irregular because of the conical projections of the premolar and molar tooth. So that's about the maxillary air sinus. Nerve supply by the posterior superior alveolar nerves and anterior middle superior alveolar nerves, which are nothing but the branches from the maxillary nerve, and the arterial supply by the facial artery, infraorbital artery, and also greater palatine arteries. Venous drainage into pterygoid venous plexus, and lymphatic drainage into submandibular group of lymph nodes. This maxillary air sinus, it opens into the posterior part of hiatus semilunaris, and the opening, it is decreased by the overlapping of the corresponding bones here. Otherwise, when we take the isolated maxilla, the opening is very large, and the maxillary air sinus is the largest sinus, and which is frequently infected during sinusitis. So that's about the maxillary air sinus. Coming to the sphenoidal air sinus, we know that this is the sphenoid bone. Okay, this is the sphenoid bone, middle cranial fossa. This is the sphenoid bone, right? So the sphenoid bone, it is having greater wing of sphenoid. This is the lesser wing. First, this is the lesser wing of sphenoid. What we are seeing is the lesser wing of sphenoid, and the remaining part is the greater wing of sphenoid, and this is the middle part, we call it as the body of the sphenoid. This is the body of the sphenoid. Okay, so within the body of the sphenoid, we will see the sphenoidal air sinus. Within the body of this is the sphenoidal air sinus. We can see the sphenoidal air sinus here. This is the hypophyseal fossa. This is the hypophyseal fossa, where the pituitary gland lodges. Hypophyseal cerebrae lodges in the hypophyseal fossa. The hypophyseal cerebrae is nothing but the pituitary gland. So the sphenoidal air sinus situated in the body of the sphenoid. So the middle part, we call it as the body of the sphenoid. So the sphenoidal air sinus, they are situated on either side of the body of the sphenoid, separated by a septum. They are of unequal size. They are not of the same size. They are of the unequal size. And this sphenoidal air sinus, it is superiorly related to the sphenoidal sinus, it is superiorly related to the hypophyseal fossa. Here, this is here. This is the sphenoidal air sinus. It is related superiorly to the hypophyseal fossa, where the pituitary gland lodges, and also it is related to the optic chiasma. So it is also related here. We have optic chiasma is present here in the medial aspects. On the medial aspect of the lesser wing of sphenoid, we have optic chiasma is present. It also related to the optic chiasma, and also hypophyseal fossa, and laterally it is related to the carotid canal. In the carotid canal, we know that internal carotid artery is present, and laterally it is related to the carotid canal, and behind it is related to the pons and medulla oblongata, separated by the basilar plexus of veins. We have pons and medulla oblongata are present in the posterior cranial fossa. We know that the interior of the skull divides into three cranial fossa: anterior, middle and posterior. So in the middle cranial fossa, it is formed by the sphenoid bone, and this is the body of the sphenoid bone, and beneath the body of the sphenoid bone we have the sphenoidal air sinuses, which is related superiorly to the optic chiasma, and also it is related to the hypophyseal fossa. Here we have a depression here, right? So this depression we call it as hypophyseal fossa, and it is related laterally to the internal carotid artery, because we know that internal carotid canal is present on either side of the body of the sphenoid, and it is related laterally to the internal carotid artery, and behind it is related to the pons and medulla oblongata. So pons and medulla oblongata are present here. Pons and medulla oblongata are present here. They are separated by the basilar plexus of veins. And coming to the arterial supply of the sphenoidal air sinus, it is supplied by the interior carotid artery and posterior ethmoidal arteries. They are supplied by the internal carotid artery and posterior ethmoidal arteries, and the venous drainage into pterygoid plexus of veins, and also cavernous sinus, because cavernous sinus is nearer here, because cavernous sinus is present at the on either side of the body of the sphenoid. So the venous drainage into pterygoid venous plexus and cavernous sinus. And the nerve supply, it is derived from the orbital branches of the pterygopalatine ganglion and also posterior ethmoidal nerve. So posterior ethmoidal nerve and orbital branches of the pterygopalatine ganglion, they supply the sphenoidal air sinus. Okay, that's, and next is the ethmoidal air sinuses. Ethmoidal air sinuses, they are present in the labyrinth of the ethmoid. See, this is the labyrinth of the ethmoid. This is the cribriform plate of the ethmoid, which is pierced by numerous olfactory which looks perforated in appearance. Perforated means what? Consists of numerous holes, which is perforated in appearance. See, because of the olfactory rootlets. The cribriform plate of the ethmoid. This is the cribriform plate of the ethmoid, which is pierced by the numerous olfactory rootlets. So this is the cribriform plate of the ethmoid. We can see in the anterior cranial fossa, this is the cribriform plate of the ethmoid, and we have one crest, we call it as crista galli. So this is the crista galli, this is the cribriform plate of the ethmoid. On either side of the cribriform plate of the ethmoid, which are here, we can't see the labyrinth of the ethmoid because it is overlapped by the orbital plate of the frontal bone, right? So we can't see the labyrinth of the ethmoid. So the labyrinth of the ethmoid consists of anterior, middle and posterior ethmoidal air sinuses. Okay, the anterior ethmoidal sinuses, it is made up of 1 to 11 air cells, 1 to 11 ethmoidal air cells, and it is present in the labyrinth of the ethmoid, and it is opens into the anterior ethmoidal air sinus. It opens into the anterior end of hiatus semilunaris, just behind the opening of the frontal air sinus in the middle meatus of the nose, and it is supplied by the anterior ethmoidal nerves and vessels. And here the lymphatics of the anterior ethmoidal air sinus, they drain into submandibular group of lymph nodes. So here is the opening. So this is the opening of the anterior ethmoidal air sinus, which opens into the middle meatus of the nose. Okay, and then is the middle ethmoidal air sinuses. Middle ethmoidal air sinuses, they consist of 1 to 7 air cells. This middle ethmoidal air sinuses, it also opens into the middle meatus of the nose, and they produce a bony bulging. We call it as bulla ethmoidalis. This bony bulging, we call it as bulla ethmoidalis. Okay, and into the bulla ethmoidalis, middle ethmoidal air sinuses open, and the posterior ethmoidal air sinus and middle ethmoidal air sinuses, they are also supplied by the anterior ethmoidal nerves and vessels, and also they are also supplied by the orbital branches of the pterygopalatine ganglion, and the lymphatics, they drain into submandibular group of lymph nodes. And coming to the posterior ethmoidal air sinuses, the posterior ethmoidal air sinuses, they open into the superior meatus of the nose. They open into the superior meatus of the nose. These meatuses are nothing but the passages beneath the concha. So the posterior ethmoidal air sinus, they open into the superior meatus of the nose, and it is supplied by the posterior ethmoidal air nerves and vessels, and also it is supplied by the orbital branches of the pterygopalatine ganglion, and the Posterior ethmoidal air sinus, it is the lymphatic drainage, it is through to retropharyngeal group of lymph nodes. So that's about the 3 ethmoidal air sinuses. So of all these air sinuses, maxillary air sinus is very important because it is the first air sinus to develop, and also it is the maxillary sinus, it is the largest first sinus to develop, and it is also largest sinus of the paranasal air sinuses of the body, and it is also frequently infected during sinusitis. Okay, if the maxillary sinus is infected, how can the fluid drain from the maxillary air sinus? Means by artificially puncturing the floor of the maxillary air sinus. We have to puncture the floor of the maxillary air sinus in order to drain the fluid, because during sinusitis what happens, it gives a persistent headache and thick purulent discharge from the nose. Sinusitis consists of persistent headache and thick purulent discharge from the nose. Usually maxillary air sinus, it is frequently infected. With maxillary air sinus, it is frequently infected because of its large size, and the fluid can be drained by artificially puncturing the floor of the maxillary air sinus. The puncturing can be done in 2 ways. It can be done by breaking the inferior concha. By breaking the inferior concha, it can be done by breaking the inferior concha, and then the fluid can be discharged. And also it can be done by through the incisive fossa. It can be done through the vestibule of the mouth. The fluid can be drained by an opening, by an incision through the vestibule of the mouth at the incisive fossa. So the maxillary air sinus, during sinusitis, the fluid can be drained by 2 ways: by breaking the inferior nasal concha, and also by piercing the vestibule of the mouth at the incisive fossa. In these 2 ways, we can drain the fluid from the maxillary air sinus during sinusitis. So these are the paranasal air sinus, which makes the skull weighted and warm up and humidify the inspired air. They act resonance to the voice, and they make the skull light weight. So that's about the maxillary air sinuses.